Good morning. Thank you for joining us. My name is Tina Cheng, and I'm the pediatrician-in-chief of the Johns Hopkins Children's Center and the director of pediatrics in the Department of Pediatrics, and really appreciate your joining us today. I am joined with David Hackam, who is our pediatric surgeon-in-chief in the Johns Hopkins Children's Center, and Maggie Moon, who is our chief medical officer, and we are delighted to be here. The purpose of this is really to really talk about what we're seeing in the hospital related to COVID-19 and children, and also to answer any of your questions and tell you about what we're doing to make sure that we are providing the best care to children amid this pandemic. So if we can go to the first slide. So I would invite everybody to send your questions on the chat, the Zoom chat, and we will make sure that there is plenty of time to answer everybody's questions. So what we wanted to go over today was, how does COVID-19 affect children and adolescents? How do I keep my children and family healthy? Is it safe to come to the emergency department, to the hospital, to our clinics, and what we are doing to make sure that we are doing the cleaning and keeping it safe and keeping social distancing going? And how do I communicate with my clinicians? I will say from the outset that we are open for seeing any children that need to be seen. We have been open during this whole time of the surge, and we have been seeing a few children with COVID-19, but we are open and available to see your children at any time, and want to see your children if they need to be seen, and are also doing a lot of telemedicine, and we'll go into that some more. So next slide. So how does COVID-19 affect children and adolescents? We have been seeing children with COVID that have needed hospitalization, but it's been minimal in comparison to the number of adults that have come in and required hospitalization. In general, there is a more mild illness in children than adults and fewer hospitalizations. There is concern about this new multi-system inflammatory syndrome in children. This is a syndrome that appears to come maybe 2 weeks to 4 weeks after a child has come into contact with COVID infection. And some of these children have been quite sick and have presented with fever, sometimes abdominal pain, and need to be seen when they have those symptoms to make sure that they are not progressing to get worse. We will talk more about this. Additionally, we have been seeing the impact of COVID on children through more worry. I think all of us have this degree of worry about, are we safe? How is COVID going to affect our children, our adolescents, and our families? So I think overall we've seen some increased anxiety. And obviously the closed schools, additional family stress and isolation concerns us in relationship to the impact on children and families. As far as the impact on our hospitals, as you may know, we did decrease and eliminate actually our elective surgeries so that we had the capacity in our hospital to see patients that came in with acute COVID illness, and did decrease our clinic availability because of the issues around spreading of COVID. But at this point, maybe I'll turn to David Hackam, our surgeon-in-chief, who might talk a little bit about surgery and what we are doing now related to our elective surgery.
Thank you. Thanks, Dr. Cheng, Tina. Hello, everyone. Thanks for joining us today, and hope everyone had a nice and safe Memorial Day weekend. With respect to surgery specifically, first of all, please know that we have maintained capacity to perform any emergency case. And we've continued to perform urgent and emergent cases. So these are kids that we see with traumas or with appendicitis or with other problems that need our care and cannot wait. We have not had anyone wait. And it's also important to point out that, as Dr. Cheng mentioned, there's really very little COVID in the Children's Center. And so we've been able to provide a safe environment to perform urgent and emergent surgical procedures. You might expect also that kids that were waiting before for surgeries that were elective, sometimes have not been able to wait much longer. And so what was elective has now been urgent, and we're doing those cases too. We have the capacity. And every child that comes for surgery, either urgent, emergent, or, as I'll talk about in a second, elective, is getting a preoperative test for COVID, and to make sure that the team knows, the family knows, and of course the patient knows what their status is. And then we can provide additional safety measures in terms of personal protective equipment, various rooms that we might put certain patients in if they are positive. We're very fortunate now that we're able to move to doing more of those outpatient cases that so many of our families are waiting for. These would be anything from tonsils for kids that have recurrent tonsillitis and throat infections, to hernias for kids that have painful lumps in their groins, but have not progressed to the point where they've needed anything emergently. But certainly if these procedures are not performed, then they would become emergencies. And we actually believe that in pediatrics and pediatric surgery, there's really very little, quote unquote, elective surgery. Just about everything needs to be done. It's just a matter of how long we can wait to get it done. We've been fortunate at Johns Hopkins Children's Center that we have access to the new Green Spring Station Ambulatory Surgical Center. And last week we started doing pediatric surgical cases up there. And so you certainly can reach out to your providers, call their offices, and ask, if they're not asking you, ask if your case can be performed at Green Spring Station. Every child that comes to Green Spring Station will have had a COVID test, will be negative, so you can be sure that you're bringing your child, your son, your daughter, your grandchild to an environment that is COVID-free. There's additional environmental measures being performed in our ambulatory surgery centers with added cleaning protocols, with more time between cases, with a focus on quality and safety. And so you'll see perhaps an experience that's a little different than you may be expecting in terms of fewer cases. It's not going to have the hustle that a typical ambulatory surgical center would have. It's going to be at a lower pace, and that's really on purpose. We don't want to keep anybody waiting, so we're scheduling at times that we have accounted for extra cleaning times, etc. But this, of course, will factor into how soon we can actually schedule your case. And so just to summarize, we've always been doing urgent and emergent cases. We're starting to do some cases that were not emergent, but now have become emergent. And we're certainly wanting to hear from you. If you've been waiting to have your surgery and you think your child's symptoms are getting worse, we want to take care of your child, and we have the capacity to do so. In the meantime, the Green Spring site is really a perfect place now, in that we're ramping up slowly. The staff are trained on all aspects of pediatric surgical care, with an additional emphasis on all those criteria that COVID impacts us. Be happy to answer questions later on, and thanks, Tina, really for setting this up, and Tricia and Nicole. Thanks.
All right, the next slide. Actually, I think we skipped a couple. I think the next slide is a slide on how do we keep our children healthy. A question that's on all of our minds. So of course we need to continue with social distancing, 6 feet, and that is at all times. And frequent hand washing, teaching your kids about washing their hands frequently, I think is incredibly important at this time. Wearing a mask or a face covering whenever you are out. Of course, if you have any symptoms, stay home and call your doctor. And make sure your child gets his or her immunizations. We have found that because of social distancing and the stay-at-home orders, that many people have not taken their children to get their immunizations, and some clinics actually have decreased their hours to give immunizations, which has caused a big decrease in the immunization rate in the state. So we do want people to continue to get their immunizations, because I think that this pandemic has shown us how important vaccines are. And that's for diseases that of the past, as well as this current COVID-19 virus. So please do get your child in if they need immunizations. And then, of course, if you have any questions, feel free to call us, and we have some further information on how to communicate with us at this time. The next slide. Is how safe is the clinic and the hospital? And I think Dr. Hackam addressed this some, but we wanted to go into it a little bit more. Your health is our #1 priority. And I'm going to turn to Maggie Moon, who will go into some of the steps we have taken to make sure that everybody that comes to the clinic and hospital are safe. So Maggie.
Thank you very much, Tina. I really appreciate a chance to talk to everybody. It's been a very interesting process considering how to reopen our clinics to in-person visits. I think that we've had a really interesting experience working with the hospital and with the Johns Hopkins Health System to think about what it takes to make sure that our clinics are safe for patients and for providers both. We're also working closely with the governor's office, who's setting out some regulations about what clinics have to achieve before they can reopen. So one of the things I wanted to explain a little bit about is some of that guidance and how we're approaching it. So we're really focusing on several aspects of the clinic visit, starting with the pre-visit. So even before, when you make the appointment for a visit, if you want to have an in-person visit, we're working to get some screening done before you come to the clinic. And so that will be over telephone or online, that you can talk about any symptoms that you've had, maybe get testing if you need it before you come to clinic. And then also during the visit, when you arrive at the clinic, we're working on what we're thinking of as a contactless check-in. So instead of going to the desk and sitting in front of the registrar, we're trying to see how much of that we can do without having any contact at all. So again, some of this will be through my chart, some of it can be online otherwise, some can be by telephone. Families can send in the information by email. And then we're working hard to decrease the wait times, because as anybody who's been in our clinics know that the waiting rooms can get very busy and very full. It's very important that we are restructuring our waiting rooms and also the waiting process so that we don't have people gathering in the waiting area. We need to be able to accomplish appropriate physical distancing, social distancing in the waiting room. So we're taking out some of the furniture, changing the flows, working carefully to make sure that there is no gathering, no clustering of patients. The Armstrong Institute for Quality and Safety has been helping us a lot with this. They have human factors engineers who've been walking with us through our clinics, thinking hard about how patients flow through the clinic and where are the areas in the clinic and what are the times in the clinic where patients are most likely to get clustered, to lump up into a group waiting for something. So we worked hard with them to erase all of those gathering issues and make sure that the flow through the clinic is smooth and without a lot of waiting in any specific areas. Of course, this is still in process, so we're piloting it with a couple of our busy clinics and to see how well we can do this, and then we'll make adjustments as we go. During the exam, we're working on a couple different things. One is to emphasize hand hygiene and appropriate protective equipment use during the in-person visit, and also really working with this notion of hybrid visits. I hope that some of you have had a chance to experience a telemedicine visit. We are working now to sort of combine telemedicine and in-person visits to minimize the amount of time that you're in the room with the provider, that you're actually physically in the clinic, but using a combination of telemedicine and in-person to get the most out of any particular visit. I think that'll be actually very interesting. And I'm sure it's important to everybody to know that we are working carefully about cleaning. We have new standards and new protocols for cleaning before and after every visit. Every time any surface is touched, how are we going to clean that surface? And our environmental care folks have been working closely with us to make sure we understand best how to do that, and then we can achieve the same standard of cleanliness and cleaning after every visit, before and after every visit. So it's been a very interesting process. So at this point, the governor has created a list of criteria that all clinics who are going to see and have in-person visits have to achieve before they can open. And so we have taken the governor's certification list as a checklist. It applies to all of our clinics, in our Rubenstein building clinics, but also our satellite clinics. So we've adopted that checklist, and actually our colleagues here in the system have actually added a few things to it because we want to really maximize the safety of our processes. So I think we'll be able to attest to certify that we've met every one of the governor's requirements plus more. So I think you can be satisfied and confident that we are doing a pretty remarkable job of protecting you, protecting ourselves, protecting our whole system. I wanted to speak a minute, this issue of how many can siblings accompany. Our goal is to have no siblings accompany a patient for a visit, just to have the parent come. The problem, we understand that that's a very difficult situation for some families, and we're trying to work on some guidance around it. But I hope everybody understands that the goal there is that we really need to minimize the number of people who are in the waiting area at any given time. And it's hard when there is the patient plus a sibling or two. We have a very difficult time making sure that we have maintained the safety that we're looking for. So we are working on some well-informed and patient-friendly guidance around how to manage this issue. But our goal is to really ask everybody to be very thoughtful about that and not bring anybody extra to the visit. So I'm going to stop right there, and happy to answer more questions about it. I'm pretty proud of the work that our teams have done. I want to tell you that the folks from our Department of Pediatrics and our Rubenstein Clinic have actually really led the way with the whole system in talking about how we want to do this. It's their work with the Armstrong Institute and the Human Factors Engineers has really been a real episode of leadership for the Department of Pediatrics, and I'm remarkably proud of the work that they've done. So I'm going to turn it back to Tina now. I'm sorry, this slide right now shows you all the things that I think we were just talking about. So these are all the things that we're trying to get done to make sure that our clinic visits are safe, that they are compliant with all the guidance from the governor's office, and that we are going above and beyond what the governor is asking.
So we wanted to next show a brief video that actually shows you some of the things that, that Maggie has described, Dr. Moon has described.
That's the end.
Hi, welcome to the East Baltimore campus of Johns Hopkins Children's Center. I'm Chrislyn, and this is Rosemary. We are child life specialists at the Children's Center. Our clinic team made this video for patients who come to either Harriet Lane Clinic, Pediatric Specialty Clinic, or Cardiology Clinic. You may have heard of something called coronavirus. The coronavirus is a newly discovered virus that causes an illness called COVID-19. As a result of this virus, our clinics have had to make some changes to help our patients, families, and staff members stay healthy.
You might notice Chrislyn and I are standing 6 feet apart. During your healthcare visit, staff will be practicing physical distancing. You will also notice that everyone must wear a mask, including you. If you don't have a mask, don't worry, we can give you one when you arrive. Now, we want to share with you the many things that our clinics are doing to keep everyone safe for your visit. To limit the number of people inside the building, patients can bring one adult with them to their appointment. Having fewer people in clinic helps us keep our distance from one another by staying 6 feet apart.
Arriving on time for your appointment helps us limit the number of people in the building and allow...
Uh-oh.
Notice Chrislyn and I are standing 6 feet apart. Sorry, we can give you one when you arrive. Now, we want to share with you the many things that our clinics are doing to keep everyone safe for your visit. To limit the number of people inside the building, patients can bring one adult with them to their appointment. Having fewer people in clinic helps us keep our distance from one another by staying 6 feet apart.
Arriving on time for your appointment helps us limit the number of people in the building and allow for physical distancing. When you first walk into clinic, whether you enter from Wolf Street or the parking garage, you will notice somebody sitting by the entrance. This person will ask you some questions about your health. After you answer the questions, you and your caregiver will both receive a mask, if you don't already have one.
Once you are in clinic, you and your caregiver might not sit in the waiting room like you might be used to. We will try our best to get you straight to the registration desks. And we actually have these new windows at every registration station. It's another level of safety for you guys.
Depending upon the type of visit you're having, you may need to go to the triage room to have your vitals taken before you go to an exam room to see your doctor. While in the triage room, you'll find out how tall you are, Measure your blood pressure and learn how much you weigh. We want to make sure you know that the triage and exam rooms are thoroughly cleaned after each patient to stop the spread of germs.
You will then be taken to an exam room. In the exam room, you will meet different team members. These team members will be wearing masks as well as face shields. We wear the face shields in exam rooms because rooms are small and we don't have as much room for physical distancing. The face shields cover our masks as an extra layer of protection for patients, families, and staff. Similar to the Harriet Lane Clinic and Specialty Clinic, there will be somebody at the door asking you some questions about your health. You will go to registration, then straight to a triage room. Once you are done with triage, you will go into an exam room or maybe an echo room, depending on what you need. We hope this short video has helped you learn about the important changes the healthcare team has put in place to help you and your family feel safe. We'd love to be able to shake your hand or give you a high five to say farewell, but right now, in an effort to protect ourselves and others, we have to wave our goodbye.
We'll see you soon. We miss you.
Hi, this is Nurse Carrie. We're happy to have you all back here. We missed you, and we are ready for you all to come back to us.
Hi guys, can't wait to see you again. Come on in.
Oh, we missed you. Hope to see you soon.
See you soon. We missed you.
See you again.
Welcome back.
See you soon.
I can't wait to pass out all the stickers we have. Come back and join us.
We miss you.
We can't wait to see you again soon in clinic.
Come back and see us soon. Stay safe.
Hi everybody, we miss you. Can't wait to see you. We're doing everything to keep you safe. Come back.
We miss you.
See you soon!
Thanks so much to our wonderful Child Life team who put that video together to show you what we're doing in our clinic. So how do I communicate with my clinicians? We're open for in-person and telemedicine visits, and the telemedicine visits have been wonderful. Please call us if you would like a telemedicine visit at the number shown here. But of course, we know that not all visits can be telemedicine visits, but we are available in both ways. My chart, you can communicate with your clinicians through my chart for questions, and hopefully you have the phone number to call your provider directly and answer any of your questions. Next slide. We have been doing a lot in gathering resources for clinicians as well as for families, and if you go to our website, there is a resource page with a lot of great information. This includes information that is for kids, and I'll show you the coloring book that Child Life put together, as well as information for families. And the next slide shows you our coloring book that Child Life put together, as well as some other information around hand washing and lots of other information. Next. This is one of the pages out of the coloring book. It's just, we don't have to go through that, but okay. And then, we are also concerned that this has put great stress on our community and our families. And we are working hard to help with things like food for some families that have, experienced unemployment or need additional food because they were using the school lunch program, for instance. We have also been helping with diapers, sometimes with formula. Please ask us if you are feeling stressed and need additional support. Next. I think that's it. So we are open for questions. And so one of our first questions is, if I am worried that my child may need to be tested for COVID-19 and they are sick, how does that get handled? Maggie, do you want to answer that one?
Sure. I think it starts with a phone call to your pediatrician to schedule the testing. We have testing in several different locations. We have tent testing, so you don't need to come into the clinic for the testing, but it starts with a call to your pediatrician who can help you schedule that test.
All right, another question. In order to reduce children who are not getting vaccinated on time, has anyone considered home visits, especially the young infants? So this is a great question. And we actually do have the Pediatrics at Home, Peds at Home home care company that is part of Johns Hopkins. And we have been doing a lot with Peds at Home related to care that we can give with their home nurses. We have not gone to giving vaccinations, however. There are some regulations on how that gets done, but it's something that we are looking into. We are, of course, open for vaccinations in our clinics. As I mentioned, we really want to make sure that kids are still getting vaccinated because we really don't want an outbreak of some other illness. We do know that there's some other clinics that have not been open. So we have been actually doing some immunization visits for some of the other clinics as well. But we are doing more in home care, and we're going to have to look more into whether we can do more as far as vaccinations. Another question has been, what about vaccines? What can we expect as far as a vaccine for COVID-19? Maggie, you want that one, or David, you want that one?
Well, that's a really interesting question. There has been, I think I read the other day that there are 100 different vaccine candidates in development, and it's a fascinating issue. The development of a vaccine is usually a very time-consuming process. I think that this coronavirus, the need is so tremendous, and that people are employing every new technology available to try and ramp up the speed at which we can develop a new vaccine. However, I think that it's still at least 8 to 12 months before we can expect a vaccine that is trustworthy enough to use in children. So I have tremendous admiration for the work being done, but I don't want to act as though it's right around the corner. But we'll be thankful when it does come. But that sort of brings me to this other notion that we've been doing pretty well with this virus in Baltimore City, in most places, but we are expecting another surge of virus later on in the summer. So we are not reducing our surveillance. We're still being massively careful. We're maintaining our visitor restrictions, although I know that they're difficult for everybody because we anticipate another surge in cases later on in the summer, and we need to stay prepared and really make sure that we are maintaining all of our guidelines.
Great. Another question, are there other symptoms to look out for regarding the multi-system inflammatory syndrome in children other than COVID symptoms? David, you want to take that one?
Thanks. So yes, the multi-system inflammatory syndrome in children is a condition that was first recognized in Europe about a month ago now, and first in England and then really throughout Western Europe, and now in New York and indeed in Baltimore. And the symptoms include not just those of COVID, which of course are a cough and fever and weakness and anorexia and a loss of taste and smell, but also some other other symptoms that are not normally associated with COVID and which can occur up to 3 to 4 weeks after the first exposure. That's really important to point out. And so these include a rash that just won't go away. And that rash can also be around the lips and around the mouth. And that's really important. Difficulty breathing is important, but a really high fever that just will not go away over several days. And then abdominal pain has been really linked, but not very heavily linked to COVID, where it's normally been diarrhea and maybe vomiting. With this MIS-C condition, the pain is really very severe. And so we would finally say if there's a child, if your child has a persistently high fever, a rash, severe abdominal pain, and was exposed to COVID, then that's a child that we should see right away. Thanks.
And I think one of the questions that often comes up is when should I call my doctor too? So I think that we've set out some sort of information that if your child has a persistent fever, rash, and even some abdominal pain, it's a good time to call your doctor. I think Dr. Hackam was referring to sort of when we need to see the child urgently, but I'm hoping that families will know to call their physicians if they have persistent fever, rash, and abdominal pain.
Right, thank you.
Another question, a great question. When will 2 parents be allowed to stay while inpatient? Maggie, I'm going to give that one to you.
So I've had this sort of fascinating and sort of unfortunate job of enforcing our visitor restrictions, but also offering exceptions to those restrictions for specific situations. So the governor has said that restrictions on relaxation of visitor restrictions will happen sort of in his third tier of opening the state back up. We are not close yet. So I think we are still maintaining our visitor restrictions, which means one parent at the bedside. 2 parents can be on the visitor list, but they have to switch out. So only 1 parent is at the bedside at a time. And we do this to maintain physical distancing and to minimize the number of people, again, in the hospital at any given time. We do make exceptions for critical events, for end-of-life experiences. We are working to try and make some exceptions for life-threatening surgeries. It's very difficult to do this, and I think actually most of our families have been very understanding of the need for these restrictions. I can imagine how frustrating they are and how anxiety-provoking they are. But for the most part, our families have been very supportive, I think, because we all sort of get the need to keep the whole project safe. So I wish I could say that in a week or 2, we'll be able to open back up to our usual family-friendly environment. What we're really working on right now, though, is to refocus our goals of patient and family-centered care within these new restrictions. So finding new ways to connect families to their child who's in the hospital using FaceTime or other electronic means while respecting our visitor restrictions. And I do understand that it has been very frustrating for some families, and I appreciate everybody's support.
All right, another question. Are you testing all inpatients and all staff? So that is a great question. We actually have begun testing all patients that get admitted to the Johns Hopkins Children's Center. And as David has mentioned, every patient that has surgery, we are getting tested before surgery. So that just helps us understand where we put the patient and to prevent any spread. As far as our staff, we have very strict guidelines that if any staff have any kind of symptoms at all, or are exposed to somebody who likely has COVID, that there is a set of rules around what has to happen as far as quarantining that staff member so that they do not bring COVID into the hospital. So we are testing all inpatients, and we have very strict rules around staff. Other questions? Well, with that, we really appreciate your faith in us in allowing us to take care of your children. We have been working very hard to make sure that we provide the best care to kids that have COVID and to the kids that need us that don't have COVID as well. We are going to continue to have some of these virtual town halls, another on Thursday, and invite you to continue to ask your questions to your providers, but also continue to ask your questions in forums such as this. We really appreciate your feedback on how you feel like this kind of virtual town hall was helpful or not. I think we're all trying to figure out how to use new technology and have become expert in Zoom. But we really want to make sure that we provide the best information to everyone as well as provide the best care to children. So thank you very much for joining us today.
Bye, everybody. See you soon, I hope.